Welcome to the Chamber Chat, your source for everything Danville and business topics that matter to you. We hope you enjoy the show. Chamber Chat. Chamber Chat.
Hi everyone, today it's just Jocelyn, no Kelly, but welcome back to the Chamber Chat. We are excited that you're here. So, today I'm here with Cliff from Hope Healthcare. Cliff, introduce yourself.
It is so good to be here. Thanks for having me.
Yay!
Yeah, I'm Cliff Swayze, Executive Director of Hope Healthcare. And for anyone that doesn't know, we provide affordable access to medical, dental, spiritual, and mental health care services to the uninsured in our community. So it's pretty special to be part of.
Love it. So how long have you been Executive Director there?
So I took over in September of 24. My predecessor, John Milan, who's just an amazing guy, he was at Hope for nearly 18 of the last 19 years.
Oh, wow.
So I had the blessing and opportunity to work with him for a month during September of 24.
Yeah.
And him to try to teach me everything he knew
It's a
in
short
1 month.
transition phase.
Right.
Yeah, that's very short.
Yeah, so I've been flying solo since October of 24 and couldn't be happier. It's an amazing organization and I'm pretty honored to be part of it.
So you didn't work at Hope before being
I did not. I actually, I was a big fan of Hope.
Okay.
I worked at Crossroads Church
Yes,
in
got
Avon.
it.
And that's actually, joining staff at Crossroads Church is actually how I found out about Hope. See, a lot of churches don't have benefits for their staff members.
Right.
So when I first started staff at the church, I asked them, I said, hey, what do you guys do for like insurance or benefits? And they looked at me and they said, well, we have Hope. And I laughed. I said, well, I have Hope too.
Yeah,
what do you do when you get sick? And so that's how I found out about Hope. And I fell in love with the organization immediately. When I learned, I've been in this community for 30 years and I had no idea that Hope existed until that point. And to know that there is such a valuable resource in this community for people, individuals and families without insurance, it was amazing to find out. So, you know, we work with a lot of individuals that were going through some sort of life transition and at church. So we were able to start sending a lot of people at Hope. Our staff went to Hope. And then this opportunity came up, and I couldn't believe it. But yeah,
I want to do it.
I was like, I couldn't think of a better organization to be part of. So yeah, it was pretty cool.
That's awesome. So what all like services are there? Because I think people don't really know.
They don't. So many people think about, you know, when you think of a clinic, especially not a hospital environment, they think of like a quick clinic or emergency
like
care
an
or
immediate
something.
care type.
Yeah, and Hope is not that. We do have primary care physicians, and that's why you establish your care. But we have so many specialties. Until people don't confuse low cost with low quality. Our clinic is amazing. We have nephrology, neurology, women's health, pediatricians, physical therapy, dietitians, nutritionists. We have a ton of chronic care management. We're bringing on a pulmonologist. There's so many things that we do because this is not just that clinic that you go to when you're sick. We're helping people long term with their wellness initiatives. Yeah.
So is your staff volunteer staff? Are they full-time staff? How does that work?
So it's funny. It's actually a combination of both now.
Okay.
But until COVID, just about everyone there was volunteer. And
That's
we've been around for 21 years. So for the first about 15 years, almost everyone there was volunteer.
That's crazy.
We have the same providers that you see at IU and Hendricks Regional and Riley and a lot of the private practices. They just believe in serving the community and they want to do good things, so they give back by serving. COVID changed things because of availability primarily. A lot of our providers just didn't have time. They were in the hospitals and in the doctor's office so much. And even our other volunteers, front office staff, it's who's coming to a clinic during a pandemic? It's sick people, right?
Yeah.
So it was there was quite a bit of transition, but even then the community came together. One of the hospitals, the Hendricks County Community Foundation stepped up and like they proactively contacted us and said, how can we help you keep
Right.
doing what you're doing in the community, especially during this time?
Mhm.
So even during that transition and losing volunteers, because of the community support, we didn't close for one day, not even during the pandemic. Yeah.
See, that's so awesome.
So with that being said, we do, it is a combination of some paid positions
Mm-hmm.
now. And that is through funding support from organizations like the
Gotcha.
Community Foundation, like our hospital sponsors, IU West and Hendricks Regional, some of our faith partners, the churches. We actually started out of Kingsway Christian Church, and they're
Oh,
still
wow.
one of our supporters
Yeah,
today.
that's awesome.
Yeah, originally we were Kingsway Community Care Center.
I didn't even know about it until
Yeah.
which is crazy considering it's been
Yeah.
around my whole life.
So, but the other great part, we've been able to expand programs. We partner with the Hendricks County Health Department as
Mhm.
well, and working with them through like the Health First Indiana, we've been able to expand care with some paid positions on both medical and dental.
Gotcha.
But the really unique thing is, more than a third of our funding
Mhm.
just comes from individuals and businesses in our
Just
community
people that want to help out.
that just believe in what we're doing, and
I love it.
they support. We can't do what we do without our community.
Yeah.
So it's a perfect example of it's people helping people,
Yeah.
right?
Yeah.
So I just think that's so cool.
I love it. So what makes someone eligible for your service? Like for any type of
We
Anything.
try to make it so simple.
okay.
The criteria is no insurance.
So literally that's
That's it. There are no geographic boundaries. There are no financial restrictions. There are no income limitations. There's no waiting period. There's no sign up. If someone has no insurance, even if it's temporary, we have a lot of patients that, they may have a new job starting, but benefits don't kick in for like 90
Right,
days or
right.
something like that. You call to set up an appointment. We don't do walk-ins
Okay.
because of those volunteers and the shifting schedules. We are open based on our provider availability.
Mhm.
So everything is by appointment only.
Yep.
You literally call. They'll ask you if you have insurance. It's a self-assertion. And if you don't, they get you set up with a provider. We
Yeah.
couldn't make it any easier.
Yeah, that really
Um,
is simple.
And it is because, and we want to keep it that way. Again, we kind of feel like we're uniquely positioned to kind of meet people where they are.
Mhm.
And a lot of them are in some sort of life transition.
Right.
We do have the people that are in between jobs or waiting on benefits to kick in. But we also have, what about single mom? Dad might have had insurance on the entire family, and he's
Right.
no longer in the picture for whatever reason. Mom might be working 40 to 60 hours per week. She might be at 2 part-time jobs and not
Yeah,
offered insurance at
right.
either place. So she's doing everything she can to support her family. So most of our patients are working.
Right.
If you're if you qualify for government programs, that's amazing. That's fantastic. But if you have Medicaid, then be with Medicaid and go to those providers.
Right.
Our only criteria is no insurance. So that means no government programs, no big business, private insurance or self-funding. It's just kind of this whole demographic that they fall into a gap. They're just overlooked by the government programs. They don't have. So we also see a lot of a ton of small business owners, a lot of contract employees. We have a lot of servers, a lot of people in the
Yeah.
service industry,
Gotcha.
because most of those are kind of independent contractors. So servers in restaurants and beauticians and nail stylists and anything that you can
Yeah.
think of in the service industry. Because again, they're not offered insurance through their employer. They're working. They're not living off programs. They don't qualify for Medicaid. They're not old enough for Medicare.
Right.
They haven't served in the military to
Yeah.
get VA. Just who helps them? And that's where there's hope.
I love it. I love it. So when you said you keep adding services.
We do.
So how do you decide? Is it somebody calls in and says, I need this, and you're like, oh shoot, we don't have it. Let me get it?
Basically.
Is that how it works?
Our goal is, our entire focus is community impact.
Mhm.
See, the greatest part about being a nonprofit clinic is I don't have some financial goal to hit at the end of the year. I don't
Right.
have some mega output number that I have to do. All I want to know is, are we making a difference in the community?
Right.
So when we focus on outcome, and not output. And the difference is, like, I track how many patients we see and all these things. Those are outputs. A lot of our funders want to see how their funds are being used. So I do track all that. But our outcome, I'll give you a prime example. We do a lot of chronic care management. So helping people with sugars and diabetes and cholesterols and all those things. We've seen such an increase in that to get people to consistently come in and check their levels with, like, the finger sticks and the A1C tests and all that. That's challenging, right?
Yeah.
People, like, are trying to work. How do you go to the doctor all the time? So we launched a CGM, a continuous glucose monitor program. It's the little devices that you wear. We got some community support, some funders and grant money to launch this entire program. Now our people that are struggling with that, they get a device, so they get real-time data, and so do we as their provider. And the results have been absolutely amazing. So that's an example of where we saw a need. We were able to go find the community support to do that, and that impact, that the outcome of these people, the health is just seeing the immediate results. I just had someone come in the clinic the other day to do, he wanted to share his testimony with me. And he said that he struggled with his levels his entire life, and now he has this continuous glucose monitor, and he said, I know exactly when I'm supposed to be eating, what I'm supposed to be doing. He said, and I wouldn't have that without hope. So that's pretty special.
So awesome. Yeah.
But another example, we started seeing an increase in pediatrician visits. So we added another pediatric provider. We do a lot of women's health. So we've actually brought on 2 additional women's health providers. So that gets us up to 3. We try to meet the community need. So as we see those needs present themselves, we try to respond accordingly.
Yeah. What is the most rewarding part about your job? Or your top 3, whatever you want to do.
That's so hard. That's so hard. So we're faith-based, and unapologetically with that. That's not a requirement to come get services, but that's why we do what we do. So when we have the opportunity to see what we believe is the hands and feet of Christ coming together, like the community, the providers, the volunteers, all that coming together to serve people, that's beautiful to even be part of, right?
Right.
So that's pretty special.
Yeah, very special.
But I have a unique opportunity. New patients fill out kind of how they found out about hope. And there's a place for them to kind of tell their story. So I sit in my office and I get these.
I would just read them all the time.
I read them all the time. But about once a week, I'm back there just bawling. I'm just crying. Because, again, meeting people where they are in their life transition. So it's such a blessing that this community has something where someone says, whatever I'm going through, I don't have to go through it alone. See, Hope can't do everything for everyone, but we connect with so many other resources. If someone comes to our clinic and we find out they're having some housing insecurities, we can get them connected to resources like Family Promise. If they're in a domestic situation, Sheltering Wings. We have so many great organizations in the community that we can help connect them to those resources. Everything from transportation with Link, insurance navigators. We just have. We're part of something really special here.
Yeah.
So between the biblically being part of the body of Christ, which is, that's kind of cool.
Yeah. This is
hearing the patient, how they found out about us and saying that they're so thankful that something like this exists in the community. That's pretty special. And number 3, probably just being a small part of something that's making such a difference in Hendricks County. Earlier this year, we were recognized by the state of Indiana for bringing public health care access in a unique way to a vulnerable population by the state of Indiana. We got, all the hand shakes and the photo opportunities and the plaque on the wall that confirms it. But just the acknowledgement that what we're doing right here in Hendricks County is becoming like a template for some of these other places. And we're getting other counties reaching out to us to say, how can you bring hope to our community? And that's really cool. That's special that, and then again, we can't do it without the support of our community and the partnerships that we have in our community.
Right.
It's just really special to just be part of something bigger than ourselves.
Yeah. So do you have like a special story that you're like, oh, this is my favorite of me being the most impactful? Or us
You know
being
what? That would change like daily.
No,
Or weekly
that's
for
what I'm
me.
saying. I would just
I was speaking at a church, one of our faith partners recently. There are some churches that have me come out and speak, so their congregation is aware of this community resource, both for their staff, but for their congregation. And we're a missionary. A lot of people think of medical missionaries. They think of, the big international mission, going the mission trip. We are literally a domestic medical missionary.
Right.
We do the same thing. We just do it with the neighbors in your backyard. And although we have local presence, we have global reach. In case you haven't noticed, there's the ethnic diversity in Hendricks County has changed quite a bit. And just ask, like the school systems, all the different languages and things that they've had to adapt. We've had to do the same. So our little Hendricks County community is reaching people all over the world, which that's kind of special too. But anyway, back to my point. I get excited.
That's okay. I love it.
Make
my job easy.
I was going to speak at this church, and the gal said, I asked to introduce you. She said, because I wanted to share my story of hope. And I said, oh, you have a story? I had no idea. And she said, I had a good job. I had insurance. I had benefits. I had my primary care physician. She said, but my health was continuing to decline. And I was actually starting to lose vision. I'm getting emotional already.
I know, don't make me cry.
And she said I was starting to lose my vision. And she said, my doctor at the time was telling me, you should probably lose weight and do these kind of things. As her medical condition worsened, she ended up losing her job, which means she lost her insurance, she lost her primary care provider. And someone at her church told her about Hope Healthcare. And so she came, and immediately one of our providers did some testing and diagnosed her with diabetes. That's why she was losing the vision. She was having macular degeneration as a result of this condition. So we not only found out what was going on, was able to get her on a treatment plan, stop the vision loss and all that stuff. And she looked at me before that and she said, who would have thought that losing my insurance might have saved my life?
Right.
Are you kidding me?
And then you have to go speak.
Now I'm going to go speak in front of the congregation. So, and that's unfortunately not a unique story.
Right.
But it's special. So, I mean, I could spend hours telling the stories. But again, I feel blessed to be able to be part of that little piece. But we can't do what we do without our community. So that's really cool. But there are a lot of those stories out there, and and
love it.
So that's pretty neat.
Yeah. Okay, so what is next for Hope Healthcare? Do you have projects? Do you have new services? Whatever.
We do. We recently, with health of the Hendricks County Health Department, with Community Foundation and some other supporters, we launched an expanded dental program.
Okay.
So we have dentists now, few days a week actually. We launched hygiene, getting into that prevention and education. It's not just restorative for us. We want to focus on that holistic. We want you to be well.
Right.
That's why we're adding, some of these other programs. So medically, we talked about the pediatrician, we talked about the CGMs, we talked about the women's health, we talked about the dental. Our counseling visits are up 67% year over year.
Wow.
Like people need these resources and they're starting to learn that hope exists. But you can come get licensed counseling, hour-long licensed counseling sessions for $30 with no insurance.
Wow.
Medical visits are only $30. Dental, most of our dental services are even less than the School of Dentistry that use the students. It's truly amazing. But one of the big things that we launched earlier this year, and this was another example that we just kept hearing so often in the community, I had small business owners coming to me, and they said, wow, I wish there was something like Hope for my employees.
Right.
To bring, because small businesses, until they have 50 full-time equivalents, they're not required to offer insurance. But if they don't offer some sort of insurance, then they have issues with employee retention or, letting it's an employee benefits issue, right? So they lose their employees to these bigger companies, and it's not because the small business owners, they don't care. It's just, what are the options out there?
Yeah.
Marketplace insurance is incredibly expensive, and unfortunately it continues to go up.
Right.
The need for Hope services continues to grow. There's been a lot of redetermination of Medicaid, and what all that means is a lot of people that qualified before don't qualify today. Marketplace went up double digits, the price last year. There were some subsidy discounts last year that ended at the end of 25, so that made it even more expensive. And the report I read 2 Fridays ago said they're estimating another 14% increase in Marketplace at the end of this year. So how do small businesses try to help their employees? Because even if they try to find a policy on Marketplace that they're putting these, subsidy, given a stipend or something, those plans are so expensive, or they're, not great coverage. So then the employee's not happy. The employer's not happy because they're spending money on something that is not even making them happy. So we put together a program called Hope at Work. And essentially we packaged all of our services to let these small businesses know they have access to medical, dental, spiritual care, counseling services. We even do have beyond the normal traditional healthcare things. Like we partnered with Hendricks County Bank and Trust for a financial literacy program called Bonsai. You've heard of that. We partner, right now we've partnered with Purdue Extension for Nutrition as Medicine program. We have an IU program right now, Fresh and Fit. Like when you're a patient of Hope, it's so much more than just coming in when you have a runny nose or something like that. But we put all these services together, kind of identified them all, and we do co-branding for these small businesses called Hope at Work, so they can give their employees this information to say, look, I've researched this, and this is someone that we want to partner with to help make sure that you're well, to keep you well, and if they help with the employee costs of that, but again, there's no monthly commitment for the employer, so that's great for them. There's no monthly commitment for the employee. They only pay if they use the service at time of service. So that's amazing. And if the company wants to support Hope for to make sure we stay around, we're a 501c3. It's a tax deduction for them. So it's been amazing. The response to that with the small businesses in the community, especially those that have, a lot of people service industry. We have had people, everything from electrical shops, contractors, to restaurants, to, hair salons and things, and said, this is great. And so I will come out, we'll do co-branding of materials, and I'll even come out and talk to all the employees and say, this is your, a benefits option. It's not insurance. It's in no way. And if they have access to insurance, they should do that. But this is an incredible non-insurance alternative, right? So anyway, great response in the community to that, and looking forward to expanding that program and spreading the word.
So you said pay at time of visit. So is there continued, if I go to the dentist, I'm schedule my 6 months out, right? Is that a thing, or is it just hey, my tooth hurts, can I come in?
Schedule it 6 months out,
and
and you can pay in advance or at the time of service. We're scheduling for those, and even your wellness visits and your follow-up, and you can see a primary care physician. We do everything starting with a primary care physician. That's to get you established into our system, because you may be having dental issues as a result of some medical issue. So we start everything with a primary care visit. That's that $30 visit, and then you just kind of go from there. But you can do your annual exams, and then your dental visit. We do, your first visit on dental will include a comprehensive exam, full x-rays, and a treatment plan. And then you can go from there to either cleanings or some sort of restorative procedure, but it's that easy.
That's awesome. So what's the best way to support Hope if you're not going to Hope Healthcare?
Yeah, absolutely. And it's funny that, so a couple things with that. one of the biggest reasons why we even charge is it really cut down on no call, no shows.
Yeah, I bet.
It's actually a very small portion of our revenue. That community support is how we stay funded. It's through grants, it's through foundations, it's through the direct donations, individuals and companies in the community. So to me, everyone is a great contact at Hope. There are only, I think everyone kind of falls into three categories. One, you or someone you know needs to know about it because they need our services.
Right.
You or someone you know is without insurance or might be at some point. And you may not think about it until, it's like anything else. Once it's, on your mind, you think, oh, wait a minute, this person may not have insurance. So you start having that conversation. So that's category one. Category two, you or someone you know can provide our services. You might not be a doctor, but you might have one.
Yes.
You might not have it, be a dentist or a hygienist, but you might have one. And they need to know too, because it gives them an opportunity to do something that they're skilled, that only they can do, and they can come back and serve and bless the community and bless the people in it, right? Three, if you don't know anyone that needs our services and you don't know a number or anyone that could support our services, you can support us. Pray for us. We are a ministry.
Right.
We don't get the big federal funding like some of the federally qualified centers and things because we're a faith-based organization. So pray for us. Spread the word. Things like this are amazing opportunities for us because again, I spend time doing as much as I can in the community.
Right.
Some people would say a lot, but everywhere I go, I hear repeatedly that people have never heard about Hope. So we have to spread the word. And the other piece of that is financial support. Like right now is a perfect time because we do one fundraiser a year. It's called Stories of Hope. It's coming up October 24th, and it's at our incredible Hendricks County 4-H Fairgrounds.
Love it.
We've had it there every year, and they're just great partners, great supporters. And so right now it is an evening of literally just sharing about hope, sharing the stories of hope. There's some patient testimonies. It's amazing
So like that
food.
would just cry the whole time.
Right?
Probably.
Yeah, there's some of that.
Yeah.
So it's a dinner and auction. It's there to be exactly that. It's to be a fundraiser for our event. We only do the one a year. So community businesses can be sponsors. We have sponsorships starting as low as $750 on up, but you can do entire tables. Like if you just want to come in attendance, an entire table is only $575. That's a table of 8, and it includes an incredible meal. Chefs in Motion, which is another local supporter, is our caterer. But it's a great evening. So, and we usually have some really nice auction items. I just came back from a trip from Ireland that I bought from one of our auction items 2 years ago. It was incredible.
Wow.
I mean, top notch, every piece of it. So that, or become a recurring donor. There are people that's just a business or individual that's just philanthropic and recurring donations are just amazing to us. And that's what a lot of our faith partners are. And that's what a lot of our individual donors are in the community. It doesn't matter what the number is, just they set it up, we make it easy. So the financial support, the provider support, or the awareness support, those are kind of the three categories.
Yeah. So you talked, when you walked in here before we started filming, you talked about a new program? Is that correct?
Yeah, so we have that, and that's that Hope at Work. That's one. So that's kind of the biggest new thing that Hope is doing right now with a small business in mind. And again, same thing applies, no geographic boundaries, because we're really doing the same thing. We're just kind of bundling it for the small businesses so they can show their employees that they care. They've researched this. They want them well. And here's access to all these things without it costing them a fortune or, making them, want to find a job elsewhere. Because a lot of people like that to work with a small business. They feel connected, but benefits are one of the big issues, and we're trying to help them address that. Again, it's community impact. That includes individuals, that's families, and our small businesses.
Is there anything else that I have not asked you that you just feel like the people need to know?
I think one of the biggest things is I invite everyone to come see our clinic.
Oh, I didn't know that.
I do tours all the time because once you're there and you see, there's this there's so many misconceptions about who we are
Yeah.
and what we do.
Yeah.
And once you're out there and you see how special it is, and people are coming in and people are friendly, and we do medical, dental, and counseling all under one roof. I mean, we're not running you all over the place.
Yeah.
The place is very nice, and the people there, they're there because they want to be there.
Yeah, right.
Right?
That would make it so great.
So it's just very different, and I wish I could tell people just try it, just come see it. We do tours, we do volunteer orientations on like the first or second Monday of each month. It's on our website, but I do individual private tours all the time. People can reach out to me. I just want them to see, regardless of how they need to get involved, either if it's as a patient or to spread the word for someone that they know, or to be a donor. We want to be very good stewards of our resources and the funds, and we want to show people what we're doing so they can really get connected to the mission. So just come see us. I would just encourage everyone to come see us.
So you want them to just pop in or give you a call?
What? Give me a call, because
there you go.
That's one of my job descriptions. It's chief coffee maker, chief tour guide, executive director, whatever. I'll do it. Copy maker. I'll do whatever. I'll do whatever it takes. But yeah, I'd love to have individuals or businesses just come see, and especially like being part of the Stories of Hope event. You can go online right now to myhopehealth.org. That's our website, and in the top banner, Stories of Hope is up there, and it shows some pictures and tells a little bit about it. But it's a great evening, and they can come, they get a great dinner, and they can get connected to the mission. They can meet the staff, they can meet volunteers, they can meet some of the patients, some of the providers. A lot of our providers go. I would just say, encourage people to find a way to get connected, because if you learn more about it, you'll see how special it really is.
So where are you located?
We are located.
That's important for people to know.
It is. We are in Avon, right off US 36, 107 Park Place Boulevard. So used to be the old high school. Everyone knows, between Dan Jones and
high school.
Yeah, so Avon High School used to be on 36. Yes, it was before your time. It's a middle school now, but directly across the street from there, between Dan Jones and Avon Avenue, on the north side, turn in the entrance to Park Place. And there's a few businesses lined up in there, but yeah, easy access off of Avon, or in Avon, right off 36.
Yep.
And appointments are phone number 317-272-0708. That's the only way to get an appointment. We don't
Can you do it through your website?
No, because of that provider availability. We try to have very personal communication. It's not the answering service, their voicemail if you can't get someone, but you actually schedule an appointment with a real person, and if there's any if you have any questions, you talk to a real person. And so we do have a website that gets into more of the details, and that's myhopehealth.org. And that can talk about the specialties and things. But one of the other things we recently launched, we're going to a new internal system that's also allowing our patients to have access to an app.
Oh, nice.
To see their visits and get their records and all those things. It's pretty special.
That's great.
Yeah.
That's great. Okay, final question. I'm really excited because I think you're going to have a really good answer.
Yeah.
But what is your best piece of life advice, business advice, a quote you try to live by, scripture, whatever you want to share?
That too changes daily.
I bet it does. We probably got lots of it.
I think it's important for people to think about their perspective. And it doesn't really matter what that is. I'll give you an example. It's not really hope related, but I'll make a connection.
Okay.
This past weekend, I had the opportunity to help my son move.
Okay.
From a 2-story house into an upstairs apartment. And when people think about moving, if someone asks you to help them move, usually, wow, what a blessing is not the first thing that comes into your mind. But while I was moving, I watched 4 generations of a family there. And they were together and they were laughing, and it shifted thinking about what a blessing it was to have 4 generations of family even connected anymore, and that they were there. And one of the family members, she has been battling cancer, and she's had 2 recent surgeries, and it's serious. And she looked while we were doing this, big smile on her face, we're all sweating, and she said, "What a blessing to be part of this." And that just stopped me in my tracks, because that shifted the perspective. See, it didn't make the boxes any less heavy, or the appliances, or the stairs any less challenging, but the opportunity to be there and what we were focused on, doing something that was serving others and blessing others. So I guess it doesn't matter if you're at work or in your relationships or your conversations. Sometimes it's not about changing your circumstance. Sometimes the circumstance is meant to be. Sometimes it's about shifting the perspective of how you view that circumstance, and that can make all the difference.
That is good. I knew you'd have a good one.
Ask me tomorrow, it might be different.
Well, thank you so much for joining me on my first solo podcast.
You rock.
Thanks. This is great.
I thank you so much for the opportunity. In case you can't tell, I'm pretty passionate about what I do.
Yes.
And I think it's pretty special to have a resource like this in the community. And you guys doing things like this to help share those resources, I think that's pretty cool.
Thanks.
So, yeah, I appreciate you.
Okay, we'll see you next week, guys. Bye.
Thanks. Bye.